coming full circle on the whole conversation because early on we talked about the importance of cleaning the eyes. So what I'd like to go through with you is a typical day of eye hygiene.
Mm.
So before bed, in the morning, take me through a full day of what you're doing with what you know to take care of your eyes.
Yeah, thanks for asking this. My routine has definitely evolved over time. Uh, I'll tell you, when I first went to optometry school, I didn't do a darn thing other than just I wake up in the morning, I put in my contact lenses, and then at the end of the day, I take them out and I go back to glasses. I fall asleep. That was like all I did. As I started going through school and I started learning about the cleaning of the eyelids and doing what are called warm compresses, I started doing those a little bit more often. And then I got even more aggressive as my own dry eye symptoms and things started, and my understanding of eyelid hygiene and dry eye got better. So right now, my kind of eye health routine, when I wake up in the morning, I am usually, I immediately put on my glasses, head to the bathroom, do my business there. And in that process, if my eyelids are crusty or for some reason they don't feel good, like if you get sleep in your eyes, right? Then I will clean my eyelids with some form of an eyelid cleanser. And usually I have eyelid cleaning wipes. There's several different brands out there. I'm a medical advisor for one of them. So I won't name brands or anything like that because there's some conflict of interest. So I'll just stay out of it. But there's many different brands and you can always consult a doctor near you. So I clean my eyelids, I'll put contact lenses in, and I'll be honest, right now I'm looking at maybe getting out of contacts. I might look into having refractive surgery, so maybe I'll get away from the contacts. And then some days, especially if it's winter time and my eyes are more irritated, I will occasionally do a warm compress in the morning. Warm compress is beneficial for people who have meibomian gland dysfunction or dry eye. So it can have a benefit there for symptoms as well as a therapeutic benefit. So I will occasionally do that for about 5 to 10 minutes in the morning. But usually throughout the day, I'm doing great unless I need to put an eye drop in because my contacts are dry. In the evenings, I take out my contact lenses if maybe an hour or two before bed. I will do either another cleaning of my eyelids if they feel gross, but usually I do a warm compress. Almost every day in the evening. I have different styles I've tested out over the time. There's some that you put in the microwave for 20, 30 seconds, and then you do it for 5, 10 minutes. There's other ones that you have like an activator button and it's kind of like those warming pads you've had if you're going hunting or something like that. They click and then they activate. There's some air activated ones now. I actually tested one of those out the other day. Those are great for people who don't have a microwave. And then there's even some USB ones. I have some of those too. I'll test those out. But I'll do the warm compress for some time. And that's a great way for, again, just getting more blood flow to the eyelids. It helps with the meibomian glands. It melts the thickened oils. And so I'll do that. I guess the other component of my eyelid, not just cleaning the eyelids, but my eyelid health regime or routine is I take supplements of like lutein, zeaxanthin every day. I take some omega-3 supplements, but I try to get that mostly from my diet. And then I will take some other various supplements like curcumin and things like that have some benefit for the eye too.
If you enjoyed that clip, you're going to want to head over here and catch the full episode. I'll see you over there.
Diabetes affects the eyes significantly. Not only does diabetes increase the risk for things like cataracts, diabetes affects the blood vessels throughout your body. And the retina in the back of the eye is one of the most highly vascular organs in your body.